MHMR of Tarrant County believes in a strong, collaborative community model, which includes a high level of stakeholder involvement, community-driven decision-making, resource blending at the local level, and with clear public oversight, providing quality, evidence-based treatments through public and private partnerships. All of our employees are committed to providing services in a way that respects the dignity and basic human rights of our clients. We provide treatment and assistance to adults, children, and adolescents with serious emotional disturbances and persistent mental illness. Treatment is comprehensive and directed toward stabilization in the home, workplace, and community.
We have a very extensive adult service delivery system that serves roughly 6,300 adults, 16 psychiatrists, nurses, psychosocial rehab. We do group therapy, intensive case management, routine case management, skills training, and many other day programming activities. We've seen individuals' lives truly impacted from coming into our services, whether they were in a crisis or needing routine medication management. We're able to see people get jobs, get the education that they need, go back and get a GED once they're stabilized on medication, and also get housing, have an apartment, live on their own, things that were never possible without getting the medication and the services needed.
When a person is in crisis, they tend to trust whomever is the person that's going to offer them the quickest relief. And that's what our crisis services do, the crisis residential, crisis respite, and crisis stabilization programs. Also, our mobile crisis outreach team, and then enhancing our crisis line. Intensive services are important because there's a segment of our population who need a little bit more than what outpatient services can provide. If they're in some kind of transition, like if they are in crisis, we certainly want to be able to take more time with them, and it will take more than an outpatient office visit. The other services, like our homeless services, it is because of the population itself that they are intensive services. Many of them are living in shelters, or they're living in campsites all over the city under bridges. And the group of people who work with them are a special breed of people because they are willing to go out there and find them wherever they are, and they will serve them wherever they are.
Project RAPP focuses on reducing the rate of reoffending for mentally impaired probationers and parolees through psychiatric and psychological rehabilitation.
We have a Project RAPP program which serves 75 individuals in the adult system with a mental illness on probation or parole. We have a jail diversion program called TCAT, which is Tarrant County Assertive Treatment, which serves 60 individuals currently in the jail system that are working with the TCAT program to get their cases dismissed. These services in particular are very important to reduce recidivism in our Texas state jails and criminal justice system. We are having high success rate in reducing individuals returning into the Texas Department of Criminal Justice.
The Mental Health Law Liaison Project provides 24 hours a day, 7 days a week telephone hotline support for law enforcement officers with the intent to facilitate therapeutic placement as an alternative to incarceration.
The Law Liaison Program was developed to help police departments, especially the officer in the field, deal with crisis and difficult situations involving folks with mental illness. We looked with local law enforcement at some models, and we came on this model where the best, what we thought might work best, is for have a telephone number that was available exclusively to law enforcement 24 hours a day, 7 days a week, with a trained professional to help them talk through problems.
MHMR of Tarrant County Child and Adolescent Services, we have what's referred to as the FAIR program. And FAIR stands for Family Assessment Intervention Resources. This is about bringing all of the services to the clients, wrapping the services around the clients and their families, and providing all the support that is necessary to help them move towards recovery. our outcomes are really good. Our outcomes on average are about 10% higher than most centers. And again, it's that wraparound model. That's what really shows our outcomes stand out, is that we're providing services at different types of periods, at different intervals, and those services are based on client need and they are client driven.
Addiction Services provides medically supervised residential and ambulatory detoxification for adults, short-term intensive residential treatment, and intensive and supportive outpatient counseling for both adults and adolescents. HIV case management and outreach services are also provided.
We partner with Addiction Services. We find that many people who have mental illness also have substance abuse issues as well.
We call it self-medication. So they may have been depressed for years and been using to cover up or to enable them to continue without the depression. Once they're clean and sober and on medications that are appropriate, they really have a good chance of starting a new life.
So it is necessary to be able to have a continuum of care so that when we identify the mental illness and the substance abuse issue, that we can treat both.
We all know that recovery is a lifelong endeavor and that they have to really work to continue this. It's only a beginning.
MHMR contracts with several community providers for skills training, medication management, case management, respite, therapeutic foster care, and hospitalization. MHMR partners with providers in Tarrant County to offer comprehensive and seamless services.
We really want to go in, work with individuals and families, understand who they are, understand what their strengths are, understand what their needs are, and then work within our own system as well as in other community provider systems to ensure that people get services available that will assist them.
JPS and MHMR's collaboration, as well as kind of the full continuum of services that we have, the obvious impact that it has had has been on the patients and the citizens within our community. Seeing people come in and being in tears and reaching out for help, and knowing that because they don't meet certain criteria to be in a hospital, a medical necessity kind of criteria, that the full opportunity to serve them has not been available.
The unique thing about the services that we have is that we're able to go out into the community and see people in their homes, go to the schools, we're able to go on people's jobs, we're able to see them in their own natural environment.
Meeting the client where he is or she is the best way to build rapport with them, to get them to come into services. They have to trust that you will go wherever they are. What is case management? It is sitting down, talking to the person, figuring out what the needs are, and helping them to get the needs met.
I think what makes MHMR stand out is the years, the experience, and the history. MHMR of Tarrant County has been around for the last 40 years, and it's during that time that you come to really develop the skills and the abilities and the knowledge and the expertise to provide services to the population that we serve. We are providers that know how to address the needs of severe mental illness.
And we do have board-certified psychiatrist, registered nurse. We're providing the exact same top quality services anyone would want. People that have a passion and understand mental illness, want to see individuals get better. It's a much more full service array than just coming in and seeing a doctor and never being seen again. People that work here want to help clients and change lives.
What I see in them is not only the passion for what they're doing, but the compassion that they use as they deal with and work with the patients that they come across.
Our consumers are no different than you and I are. They want the very same thing that you and I want. They want on a Friday night to go on a date. They would like to go see a movie every now and then. They'd like to go out to dinner. And they'd like to be recognized for good things that they do. You know, mental illness can be a very difficult and challenging thing to deal with. And I'm here to say that MHMR of Tarrant County has services that can definitely impact the quality of life of folks.